Constantly hungry? Constantly starving? You may be insulin resistant. Normally, when we eat food, it becomes glucose and enters our bloodstream. In response, pancreas releases insulin. The insulin binds to the glucose and takes it to the cell. Here, the insulin attaches to the insulin receptors and transports the glucose into the cell. The cells use this for energy, mostly in the muscle, fat, and liver. Once the glucose is used up, the glucose and the insulin levels return to normal. Now let's see how insulin resistance develops. When you eat ultra-processed foods high in calories, carbs, and fat, it raises the blood sugar even higher. The pancreas works overtime and produces more insulin to try to bring the blood sugar down. Over time, the pancreas cannot keep up with the sugar overload and the cells stop responding to insulin. They become resistant to the effects of insulin, which is known as insulin resistance. So what happens now? There's excess sugar in the blood, but the cells do not have sugar for energy production and are starving. Now you're constantly hungry and crave sweet and salty foods. This leads to a vicious cycle which causes obesity, various diseases such as metabolic syndrome, type 2 diabetes, fatty liver, and polycystic ovaries.